Angular dermoid cysts are benign, slow-growing neoplasms that result from entrapped ectoderm at the site of embryological bony fusion. They are usually diagnosed in childhood and are common in the periorbital region as an internal or external angular dermoid. The gold standard for the treatment of periorbital dermoids has been open surgical excision via a skin incision. An open surgical intervention, though curative, is associated with a scar, and if not placed elegantly within the eyelid crease, can be unsightly. Moreover, large dermoid cysts presenting late in life cannot be excised through a hidden incision. The use of sclerosant-based sclerotherapy is a known treatment modality in the management of conditions such as visceral cysts, varicoceles, varicose veins, hemangiomas, hydrocele, and various other cysts all over the body. Closer to the eye, sclerotherapy has also been reported in the management of cystic lymphangiomas and orbitopalpebral cysts. This video highlights the technique followed by our group to introduce this novel therapy. In this technique, the sclerosant used is sodium tetradecyl sulfate. Sodium tetradecyl sulfate is an anionic surfactant. In vascular lesions, its mechanism of action is known to be intimal necrosis, adventitial fibrosis, vessel thrombosis that leads to luminal collapse. Prior to sclerotherapy, the diagnosis of a dermoid cyst is confirmed by the classical history such as a long-standing slow-growing painless mass and clinical signs such as a smooth cystic mass at sutural junctions with bony fixity. In computed tomography scans, dermoids appear as well-circumscribed cystic lesions, usually heterogeneous due to keratin debris and lipid globules associated with bony fossa formation. It is also important to recognize its deeper extent, if any, especially in cases of large bilobed or hourglass dermoids. Other differentials that may be considered while examining a case of orbital dermoid cyst include an ethmoidal sinus mucocele, a lacrimal mucocele, a non-regressed capillary hemangioma, or a meningoencephalocele. Foam sclerotherapy is performed under local anesthesia for cooperative adults. First, the desired site of the stab incision is marked, and then 0.2 ml of 2% xylocaine and 100,000 parts of adrenaline is injected into the overlying skin. A 3 mm stab incision may be made on the skin and orbicularis to visualize the cyst wall. Then, an 18-gauge needle mounted on a 10 cc syringe is inserted into the cyst, and the white material is aspirated until the entire cyst collapses. Manual expression of the ectodermal contents may also be done. Any protruding hair shafts are removed manually using a forceps. Thereafter, a 0.9% normal saline wash may be given to further empty the contents of the cyst. 1 ml of sodium tetradecyl sulfate in the concentration of 30 mg per milliliter is vigorously swirled for 1 minute from one tuberculin syringe into the other using a three-way connector. This procedure helps to create frothing within the sclerosant to form a 3:1 fluid-gas ratio. The sclerosant is then injected into the cyst in an amount that equals 10% of the cyst aspirate. The frothing helps to increase the surface area covered by the sclerosant and thereby ensures that it reaches the entire secretory epithelium lining the cyst. A single 6-0 vicryl suture then may be placed over the orbicularis and skin to close the wound. Alternatively, the wound may be patched. Routine postoperative care is advised for 1 week. In a few cases, we have noted partial resolution of the cyst and repeated the sclerotherapy with satisfactory results. Our results have convinced us that this technique is far less invasive than surgical removal. It is especially useful in adults with larger dermoid cysts which may not be amenable to resection through a small hidden lid crease incision. The sclerotherapy technique offers a scarless surgery with aesthetically pleasing and reproducible results. For small dermoids in children, we still prefer a one-time surgical excision. However, for large dermoids, this minimally invasive foam sclerotherapy is a safe daycare procedure that can be performed under local anesthesia with minimal tissue handling and damage.